This is a cam clip number 7 is a much longer clip. We're going to start looking at the different bones in groups here. So first of all, we'll talk about every time we talk about a system, we talk about the main organ versus these accessory structures or accessory organs, depending on the system. So of course, the main organ in the skeletal system is going to be the bone. Remember that they're active living tissues. Whenever we talked about an organ, we said it had to be 2 or more tissues, so it's connective. And nerve tissue is within this. Blood, of course, is a type of connective tissue as well. Accessory structures, so the joints, cartilage, ligaments, and tendons are all need to be considered when we talk about bones. So let's talk about what is the structure of a ligament. So a ligament is a fibrous connective tissue, and it joins 2 or more bones together. Okay, so it's sort of how they are structured. They're lashed together. Okay, bone to bone. Always make sure you understand the difference between a tendon and a ligament. A tendon connects muscle to bone. So sutures. So suture is a type of immovable joint. I'm just going to go to the next picture. And we find it between 2 flat bones. And the most common place we find it is in the skull. There isn't any activity. There's no bending here, hopefully. And what it is, it creates a very strong but a jagged connection here. Okay, not a straight up and down connection, and gives it very strength because of course our skull is very important to protecting our brain. So now we're going to look at the various types of sutures in the cranium. So I'm going to go to this picture. So the sagittal suture, which you can't see here, it fuses, it'd be right down here. Okay, so it fuses the 2 parietal bones of the skull, the light blue one here, and sagittal suture, versus the coronal suture right here, right, which is fuses the frontal bone to the parietal bone. The lambdoidal suture, which is here, okay, and connects the occipital bone to the parietal bone. Those are the main ones. There are other ones, but those are the 3 main ones that we wanted to talk about. Just another picture here, looking at, you can see the coronal suture quite well here in this one. Now the other thing we should talk about is fontanelles, and I'm going to go to the picture here. So at birth, many of the bones are not fully developed in an infant, and skull has part of those bones that aren't developed. There are fibrous membranes that connect the bones of the skulls, but they leave these sort of soft spots, if you will. The purpose for the fontanelles is to allow for ease, if you will. Now that's a contradiction in terms, but through the birth canal, because it allows some movement. And sometimes you may have seen maybe one of your children or somebody else's child born and kind of a cone head look to them because of the molding that's happened through the birth canal, and that'll all go back into shape, not to worry. But the 2 main ones we want to look at here, of course, are the anterior and the posterior. In these so here's the anterior one here, and this is the posterior one. You can see there's one here and one here, but we're just going to talk about these 2 main ones. 2 things that are important. I can feel, if I put my hand on that little spot on a baby, I could feel pulsations through there. As well, it facilitates some diagnostics for us. If a child came in to emerge and was screaming and yelling, and this fontanelle was bulging, we would be very concerned that there might be some intracranial pressure in there. Versus if it was quite dipped down, we would be worried that maybe that child is dehydrated. So it is important for a diagnostic tool. So I'm going to go to the next picture, which shows these 2 quite clearly. So the anterior fontanelle is diamond shaped, as you can see, okay? And you can see that this is the frontal bone and these are the parietal bones right here, okay, here and here. and it closes somewhere between 18 months and 2 years. And so when a baby has its well baby checkup, that should be checked to make sure it doesn't prematurely close, because otherwise then the cranium would be too tight and the brain wouldn't be able to grow as much as it should. Posteriorly, we have another one, a little more triangular in shape, okay, versus diamond, and it should close somewhere before 1 year. Just looking at it a little bit different, the infant skull.